September is Prostate Cancer Awareness Month. Prostate cancer is the third most common cause of death from cancer in men of all ages and is the most common cause of death from cancer in men over the age of 75. TGMC would like to take this opportunity to raise awareness of this condition and its warning signs within the community.
And welcome to Your Health with Terrebonne General Medical Center. And joining us now to discuss Prostate Cancer Awareness Month is Dr. Jeffrey Long, a radiology oncologist. Thank you very much, Dr. Long, for joining us tonight.
Pleasure to be here.
All right, let's start it off with just informing everyone exactly what prostate cancer is.
Well, prostate cancer is a cancer that arises in the male prostate gland. Now, the prostate is a walnut-sized gland that men have, and through the prostate, the urethra runs, which is a tube that drains urine out of the bladder and outside of the body. This is the organ that the cancer arises in. If the prostate becomes enlarged, it can interfere with the flow of urine.
Okay, and how does one prevent prostate cancer?
Well, unfortunately, there's really no good way to prevent prostate cancer. Prostate cancer is best managed by early detection when cure rates are very high.
All right, and how prevalent is prostate cancer?
Well, the startling statistics are that 1 out of 6 men are going to develop prostate cancer at some time in their life. Even more startling is the fact that of all men, all of us, 1 out of 36 will ultimately die of prostate cancer. So prostate cancer is a huge health problem. Now, prostate cancer is a cancer of the elderly. About 65% of people that are diagnosed with prostate cancer are men that are age 65 and above.
Okay, all right. And so who is at risk for prostate cancer?
Well, African American men and those with a family history of prostate cancer are at a higher risk of prostate cancer. For this group, we recommend that their prostate cancer screening start at the age of 40. For all other men without those types of risk factors, it's okay to start prostate cancer screening at age 50.
Okay. What are potential symptoms for you to look for prostate cancer?
Well, now, most of the time, prostate cancer really has no symptoms, especially in its earliest stages. Most of the time when we find prostate cancer, it's found by what we call a blood test called prostate-specific antigen, which we'll abbreviate as PSA.
Okay.
Early prostate cancers can also be detected by a digital rectal examination.
Okay, and how else is prostate cancer diagnosed?
Well, there certainly can be symptoms of more advanced prostate cancer. If there's symptoms of men having difficulty emptying their bladder, hesitancy in urination, or discomfort urinating, it's possible that that's a symptom of a more advanced prostate cancer, but I want to emphasize the great majority of time that those symptoms occur, it's not due to prostate cancer. However, having said that, any man having those types of symptoms really needs to discuss that with their physician.
Okay, and after discussing with their physician, how is prostate cancer treated if it is in fact prostate cancer?
Well, of course, the first thing you do is you want to confirm that there's prostate cancer. That requires a biopsy.
Okay.
And then when they look at the biopsy under the microscope, they assign what's called a Gleason score to it. That ranges from 2 to 10, and the Gleason score correlates with how aggressive the cancer cells look under the microscope. But taking into account factors like the PSA value, what you feel on digital rectal examination, and the Gleason score, us doctors work together to find a treatment strategy that's best for that particular patient.
Okay, I'll tell you what, Dr. Long, what we'll do is we'll take a short break. When we come back, we'll talk about Mary Bird Perkins Cancer Center at TGMC and what they offer in treatment for prostate cancer. So that's coming up right after this break.
Put together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
Think of 6 men you know. One of them will get prostate cancer. Early detection can save a life. Make an appointment with the experts. Mary Bird Perkins Cancer Center at TGMC.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
And welcome back to Your Health with Terrebonne General Medical Center. We're talking with Dr. Jeffrey Long regarding prostate cancer, as it is Prostate Cancer Awareness Month. And now we're going to transition and talk about the type of treatment and support that Mary Bird Perkins Cancer Center at TGMC offers, Doctor.
Absolutely, Jason. There's actually several different treatments for prostate cancer. Prostate cancer can often be treated surgically with surgical removal of the prostate cancer. Certainly, prostate cancer can be treated with my medical specialty, that being radiation therapy, which is curative in many men that have early-stage prostate cancer. Another treatment approach is called brachytherapy, and that's the placement of tiny radioactive seeds into the prostate gland. At other times, we recommend a medical treatment which results in reduction of the body's naturally occurring testosterone level to help shrink the prostate cancer.
Okay. And if somebody is diagnosed with prostate cancer, a lot of times they want to know, okay, well, what's my survival chances? What's the survival rate for prostate cancer?
Well, Jason, here's the really good and exciting news. If prostate cancer is caught early enough, according to American Cancer Society statistics, the survival rate, the cure rate, is close to 100%.
Oh, wow.
And that's good news for men. That's a very special thing that we can do with prostate cancer, hence the exceptional importance of screening to catch those prostate cancers early.
Okay, so it's certainly important to get screened. Does Terrebonne General Medical Center offer prostate cancer screening?
Absolutely, we offer prostate cancer screening, and in fact, our very next prostate cancer screening is coming up September 21st. Okay. And the times that we'll be doing it that day are from 10 to 12 and from 1 to 4. That's going to be conducted at the medical atrium at Terrebonne General Medical Center. Now, these are going to be screenings that include the blood PSA test that we've been talking about, and also an examination by a physician. Now, you want to sign up early for this because last year we screened over 300 men. This is a very popular free screening, and certainly we're going to hope to be saving lives by catching prostate cancer early through these types of screenings.
Oh, certainly, certainly. Well, I know, there's a lot of construction going on, a state-of-the-art building being built right there on the campus of Terrebonne General Medical Center. When will the new Mary Bird Perkins Cancer Center at TGMC be opening?
More exciting news, Jason. At the end of September, the brand new Mary Bird Perkins Cancer Center at Terrebonne General Center will be open. That's exciting because we're going to have a comprehensive array of services under one roof. Under one roof, we're going to provide the services of radiation oncology, medical oncology, surgery to treat cancer, pathology, social services, and a whole host of other services, all focused on the cancer patient to give them the best chance at survival and to make sure that they have the best chance of quality of life after their cancer treatment is done.
Okay, excellent. Mary Bird Perkins at TGMC has a golf tournament coming up, as I'm aware of. When will that be?
You're absolutely right. The Mary Bird Perkins Cancer Center at TGMC is going to be having a golf tournament that's going to be called the TGMC Open, and that's going to be conducted between September 26th and October 1st, and that's going to be held at the Ellendale Country Club. All proceeds will benefit Mary Bird Perkins Cancer Center at TGMC so that we can continue to serve our patients with cancer optimally. Teams and sponsorships are still available. Sure encourage anybody interested to call that number that you saw on your screen there, which was 985-873-4616, for further information.
And Dr. Long, if you want more, if somebody out there has seen what we've been discussing and they're concerned about getting tested or, you know, prostate cancer and getting screened and things like that, where can they go for more information to schedule appointments for screenings and things of that sort?
Absolutely. We've got a couple ways that they can find more information about our prostate cancer screenings. We do this periodically throughout the year, so if they can't catch the September 21st screening, there will be others available. Anybody interested, please call 985-876-9045, or you can go to the website. That's www.tgmc.com or www.marybird.org/TGMC. You'll get all the information and contact information you need to get that prostate cancer screening. The life you save may be your own or the one you love.
Well, that's a very good way to end it. Thank you very much, Dr. Long, for joining us. We appreciate it.
It's been a pleasure, Jason. Thank you.
Yes, sir. All right. With that, we'll take a short break. When we come back, we'll have more for you.